It is about working with key partners together in our community.
Delivery of the right care in the right place at the right time.
We are talking about a patient revolution.
The clinicians will be deciding on the pathways of change.
It is the biggest NHS shake-up in 60 years.
The message that we want to come out from our emerging CCG is one about change. This has to be completely different from what has been happening before.
Quality is one of our #1 priorities, putting patients at the centre of their healthcare.
Andrew Lansley's quote, "No decision about me without me." We want to make that real for people.
I've never heard of clinical commissioning groups.
North Hampshire clinical, no, I've not heard of that at all.
I've heard about the clinical groups. I mean, I think they can work together. If they do, it'll be a good thing.
The clinical commissioning groups are groups that are coming into being as statutory organisations, taking over from primary care trust and strategic health authorities as of the 1st of April next year. And they will be predominantly GP-led or clinician-led commissioning groups. Commissioning actually means the buying of healthcare for your local community.
I think the values and the vision of our emerging CCG are going to be around improving health outcomes for our population. And this will achieve through the greater collaboration of all our members. And I don't just mean member practices, who are of course central and very important, but the public, the local authority, the voluntary organisations. We're going to do this in a transformational way.
The key to the membership organisation, and that, if we remember, is 22 practices, 150 GPs, 220,000 people. The key to all that is embracing them, their thoughts, how they'd like healthcare to be delivered, so that in this organisation, North Hampshire Clinical Commissioning Group, it's about embracing all of their thoughts and turning those, translating them into healthy outcomes for the people of this area.
The clinical cabinet will be largely made up of GPs, people who spend the majority of their working week seeing patients, and so they will naturally have a view of the things that the patients are reflecting back to them.
I think GPs should deal with patients. I don't think they should have to deal with budgets.
I think there will be several values that underpin what happens in the clinical cabinet. The first value will be around quality. Another value that I think we have to bring into play is we have to consider the resources that are available to us. So yes, we're looking for quality, but we have to be mindful that we have a finite resource, a finite pot of money.
I think they should spend money on preventative medicine long-term wise, as it will help the budgets long-term as we're all growing older.
Long-term conditions is a very important area for us to concentrate our commissioning priorities on, because people live with a certain condition for a long time, which can be very difficult for them. So making sure that they receive the correct treatment is important to us.
There's a number of ways in which we will decide on what the priorities are. The Public Health Department produce a document called the Joint Strategic Needs Assessment. That is a very good summary of where we are and where we need to get to. And we'll be taking into account the views of all the clinicians across our locality.
First injections for Indiana. Yep. Is your first baby?
Yes.
Yes, yeah. Okay, so this is all new for you.
Yes.
The main commissioning priority for us is to encourage our patients to stay healthy. We're also prioritising unscheduled care, which is where patients turn up at the hospital through the A&E department, through planned care, which is where you routinely attend the hospital, prioritising children and maternity services and mental health services.
One of the big things that people don't do, or they always expect to do, is to know things. But unless people communicate, you don't know a thing.
There are two things that patients can do to get involved with clinical commissioning and be involved in healthcare in this area. One thing is when they sit in front of their doctor, they can ask if there's something that they can do about their problem and how they can deal with it. But if they want to get involved in the wider new patient revolution, then they could contact their GP surgery and ask if there's any way they can get involved with their patient group.
I've heard of them, I've seen the leaflets up in the surgery. I haven't joined yet, but it's something I feel I should do.
There's very good evidence around the country that models of care where patients are involved improve health outcomes, and particularly in the long-term conditions.
I think it's probably fair to say in the past there's a little bit of silo working that has gone on, but now the CCG is encouraging all of the providers, whether they be secondary care or whether they be community care or social care, to work together in partnership to deliver a total package of care that patients need.
We got together with the trustees, with the local community, with other stakeholders, and I'm really proud to say that it's reopened recently, providing a range of services to that community.
Certainly the integrated care approach is where we're trailblazing, and another big area for us has been around the delivery of end-of-life care.
Every single patient want can't be turned into a need that will be delivered. And that isn't just about saying no to everything.
So the vision for the future is that people are listened to, and I've been talking to lots of organisations, and what they want is local input, and they want to feel that when their voices are heard, we're embracing the whole of the healthcare economy.
The people of North Hampshire should see a complete change. They're going to be empowered, they will have a voice. With that voice will come responsibility, and I hope that we'll then see a change in the way that they use the service.
Do we all need the NHS? You bet your sweet life we do.